with that, I'm going to introduce our next chair and moderator, and let him do the introductions for the next panel. This is a panel which is focused on veterans' health needs during the coronavirus pandemic. So really looking at what are those needs that are coming up across the community, not just anecdotally, but even as we start to survey across with this pandemic, both directly and indirectly relating to COVID. And we'll be talking about solutions later in the day, but I'm sure there's some that are already coming online. With that, I want to introduce our moderator, and that is Colonel Sam Whitehurst. And I've been talking and working with Sam for a while as Consensus Health and Dixon Center look to see how we can bring tech to be a part of the solution for what's going on with veterans. And it's been great to understand from his perspective as this pandemic hit, what was coming in and impacting all of the people he was working with. And it really wasn't what you expect all the time. Sometimes it's just, hey, we got a person in a program, and now that person, that program is just folded because of the economic downturn. And he's been sort of my lens and my guide into how some of these problems have been cropping up, and help me realize that it's significant and it's different than across the civilian population. We are all obviously as a society dealing with a tremendous amount of challenge right now, but it's those unique challenges that the veterans community is facing that I think Sam taught me about and started to get me thinking that we needed to have some special focus on it. So Sam is a retired Army colonel, and he is the vice president at the Dixon Foundation. So with that, I will let Sam introduce the great panel of experts that he's brought to join us today, and take it from there. Thank you, Sam.
Hey, thanks, Sean, and it has been great working with you. And Heather mentioned in her opening remarks about how we had the opportunity to meet with you and her very early on. And I tell you, as much as I've embraced kind of the new technology we've all been embracing over the last 6 months, and really using it as an opportunity to connect with more people, I do miss those opportunities to meet in person, over a cup of coffee at a coffee shop. So I look forward to that, to kind of getting back to that once again as we go forward. So I'm back on. I am, as Sean said, my name is Colonel Sam Whitehurst. I retired from the Army about 1.5 years ago after almost 30 years where I served as an infantry officer. In my last assignment in the Army, I was the director of the Army Soldier for Life program. So in that space, that's where I started really to get exposed to all of the different groups, whether it's private sector organizations, whether it's nonprofits, think tanks, academia, individual communities, all who were focused on supporting, in my case, our focus was on transitioning service members, but we also looked at veterans and their families as well. And so I was very fortunate to be able to continue that work once I retired and joined Dixon Center for Military and Veteran Services. So I have the honor, very distinct honor, to moderate our first panel today, Veterans' Health Needs During the Coronavirus Pandemic. So hopefully this discussion is going to really set the stage for the rest of the day. What we are hoping to accomplish is really identify and discuss in detail some of the needs that our veterans and families are facing, some of those unique needs that Sean mentioned and Colonel Milne mentioned, really dig down in some of those unique challenges and needs that our veterans and families are facing as we look toward discussions on the subsequent panels as well. So, and I think, Rosie, I think you're sharing your screen right now.
Okay, sorry about that.
That's fine. That's fine. Yeah, and so let me I'll introduce our panel members. First, I want to introduce Cristy Gamez and Amy Harkins, who are both from Easter Seals Greater Houston. Cristy and Amy are clinical psychologists who the rest of their team at Easter Seals Greater Houston have been on the ground, literally been on the front lines addressing the mental health challenges of veterans and their families during the pandemic. And as we all know, Houston, unfortunately, has been an area that has been significantly hit hard by the coronavirus, by the pandemic. So I think I'm very interested in hearing their observations and their experiences over the last 6 months as they've been dealing with that. And I also want to give a shout out to the people in Houston. Obviously, this hurricane is supposed to make landfall, I think, sometime early tomorrow morning. I've heard different reports between Louisiana, but obviously you're talking about Louisiana. Houston is obviously part of that larger area as well. So our thoughts are with the people of Houston as they are dealing with that challenge. I'd also like to introduce Rajeev Ramchand, who is a senior behavioral scientist at the RAND Corporation, where he studies the prevalence, prevention, and treatment of mental health and substance use disorders in adolescent service members, veterans, and minority populations. He is also one of the authors of the recent report by the Bob Woodruff Foundation, Veterans and COVID-19, Projecting the Economic, Social, and Mental Health Needs of America's Veterans. Anyone who's in the veteran space, especially the veteran nonprofits, has been really looking toward this report. And you'll have to correct me on this, Rajeev. I believe it came out sometime in May. I may have that wrong, but that really has become the key report that everyone has been referencing and looking at as we are looking at to how this may impact veterans and their families. So it'd be great to hear his observations about that as we go forward as well. And then also joining us is Rosie Torres. Rosie's having some challenges with her webcam right now, so we don't have her on video, but she is on audio, and so we'll get a chance to hear her insights as well. Rosie, along with her husband, Captain retired Leroy Torres, through their nonprofit Burn Pits 360, they're nationally known advocates and thought leaders on the impacts that exposures to burn pits in Iraq and Afghanistan, as well as in other areas where we have service members throughout the world, but principally in Iraq and Afghanistan, is having on the health of service members and veterans. We've touched upon that a little bit throughout the morning already about the burn pits and the underlying conditions that they've created in our veterans and how that makes our veterans more susceptible to the catastrophic impacts of COVID-19. So she'll have some, I think she'll have some great insights to that, as well as maybe some tools for some of the providers that are out there to help them work with veterans and their families who are working through some of those challenges. So again, I think we have a great panel today, and look forward to, I think, what's going to be a great discussion. Before I really get and really turn it over to the experts, because I do want, I want this to be about less talking by me and more talking by them, because they're the experts on this. I do want to kind of set the stage for us a little bit, and I'm going to share with you some statistics and some observations that many of us have seen already over the last 6 months of the pandemic and how it's impacting veterans. So I'll start off. As of this past Sunday, if you look at it across the country, across the U.S., the current numbers were, we've had 5,672,671 infections. And then of those infections, there's been almost 180,000 deaths. Now, this was as of Sunday, so obviously this data has probably changed over the last 48 hours. Among veterans, now those first numbers were the entire population across all demographics, but among veterans who receive their health care through the VA, and that's an important distinction, but those who receive their health care through the VA, there have been over 49,000 infections and 2,564 deaths. Now, again, I want to make the distinction. These are only veterans who've been treated in VA facilities. So we know that number, the number of infections as well as the number of fatalities, unfortunately, is much larger. And while there's, as of yet, there's no data focused specifically on veterans based on race or ethnicity, I think we can make some pretty good assumptions that if you look at the CDC data for African Americans and Hispanics across the U.S. that they are experiencing 2.6 to 2.8 times higher in terms of infection and 1.1 to 2.1 times higher in terms of fatalities. So again, I think we can assume, make a reasonable assumption that we'll see those same disparities between gender, race, and ethnicity, as well as we're seeing in the general population. And we've already touched upon this, but veterans as a group, I think one of the unique challenges they have, they do tend to be more susceptible to the catastrophic effects of COVID-19 because they tend to be older as a group, and they do have some unique underlying conditions, which again, we're going to talk more about those and how things like exposure to burn pits has led to some of those unique underlying conditions. We'll talk more about that. Colonel Milne touched upon this, but there are also secondary effects to the pandemic when we look at our economy and unfortunately the rising unemployment rate. As he said during his talk, just a few months ago, while underemployment has continued to be an issue that's dogged veterans for the last several years, in terms of unemployment, though, we were at record lows just a few months ago. As we've all seen, that has been turned on its head, where I know it has fluctuated greatly. You start taking a look at the April and May, June, December data, it continues to fluctuate. And at one point we were back in double digits. It is now, as of July, the unemployment rate for veterans overall is just under 8%. Not good, but a little bit better. And 10.7% for women veterans. And if you really start to dig into those numbers, though, again, you're going to see differences based upon gender, race, and ethnicity, and you're also going to see difference based upon the period of when the veterans served. But for all those different subgroups, the lower number is usually going to be about 8%. And unfortunately, some of those numbers, depending on what the subgroup is, are creeping up toward 11%. And we're going to talk more about that. We're going to talk about the impact of that economic uncertainty. I think we're going to talk about the anxiety about the virus itself, the isolation and loneliness attributed to social distancing, how they've all combined to form this perfect storm of stressors that are going to have a significant impact on the mental health of veterans and their families. And unfortunately, when we start talking about increased challenges with mental health, there are some downstream impacts of rising suicide rates and rising substance abuse rates as well. I saw a recent study, or a recent report from the Meadows Mental Health Policy Institute in Austin, where they have projected we could lose an additional 550 veterans to suicide every year for every 5% increase in the national unemployment rate. And also discouraging, we also could see more than 20,000 more veterans suffer from substance abuse annually compared to where those rates were pre-COVID-19. So these are all issues that we're going to talk about over the course of this panel. And again, I think we have some great experts who can speak to that and really dig down into it. And just as Sean said, we really want this to be interactive. So as you have questions, please submit them in the function. So that's going to Sean or some of the other folks kind of working this in the background, and they'll get those questions to us so we can answer them as we go along the panel. I've been involved in panels where we always kind of wait to the end to answer questions, and you invariably always run out of time. And so your questions are more important than the questions I have. So I encourage you to ask those questions throughout, and we'll stop and we'll try to answer those as we go along to make sure we're answering as many as we can. So with that being said, I'm going to turn it over to our panel members to better than I introduce themselves, and also to make any opening remarks if they would like to. And I'm going to start with Cristy and Amy from Easter Seals Greater Houston. So Amy, you're kind of top on my Hollywood Square here screen I'm looking at. So I'll start with you, Amy, and then we'll go to Cristy after that.
Okay, so just to introduce myself, my name is Dr. Amy Harkins. I am a psychologist and a clinician full-time with Easter Seals of Greater Houston. And at Easter Seals, I'm able to provide individual therapy to adults. That's my preferred group of people to work with. And we were doing therapy in person and also using the video telehealth services before COVID happened, and then transitioned over to doing it all virtually. So Easter Seals of Greater Houston is maybe something that a lot of folks don't have much knowledge about who we are. But if you think back, you might remember the Easter seals that people would put on the back of their envelope. That was one of the early fundraisers. Easter Seals' mission is to help people with disabilities, and it's a cradle to grave mission. And we are really well known for the work that we do with the little babies in the early childhood intervention programs. But working with veterans is also one of the areas that we're able to work with folks in the Houston area and their family members and their loved ones and caregivers. So I'm really happy to be involved with Easter Seals of Greater Houston in that capacity. And Cristy, you're my boss. Oh, Cristy, I think you're muted.
Thank you. So I'm Cristy Gamez, and I'm a psychologist. And what do I say? I can say I lead a fabulous group of clinicians over at Easter Seals, and we're happy to serve the veterans, their family members all across this area and into the Brazos Valley. So we've been very fortunate to have a couple of grants that allowed us to spread the love everywhere, if you will. So we see children, very small children, and then all the way up to seniors. I think the other thing that I want to point out is that we have also started to do or have been doing, depending on what happens in the world, the greater world, things to kind of meet those needs in the veteran community. So Amy can talk a lot about what she did post Harvey and do in terms of creativity. And right now we have an art project. It's going to be a virtual gallery that we're building by having veterans and their family members submit art about how they have been able to get through COVID. So we have another team member who we learned through this that she's an artist in her other side of her life. And so she's heading up that project. So yeah, I think it's one of the fortunate things that we've done is been able to just kind of branch out into new ways, much like Colonel Milne said, and try to engage people, because mental health is often not the thing that people want to engage with. So that's a little bit about me.
Thanks, Cristy. Yeah, and now we'll go over to Rajeev next.
Hi, everyone. Thanks, Sam. My name is Rajeev Ramchand. I'm an epidemiologist at RAND. Before COVID, not many people knew what that was, so we have some brand recognition now. I spend half of my time also at the National Institutes of Mental Health. And I think that what I'd like to convey right now is I feel overwhelmed if other people feel overwhelmed. And I'm not talking about just personally overwhelmed, but information. There is so much information out with respect to mental health, with respect to COVID, with respect to possible treatments, perspectives. I think that if you feel inundated and lost in the maze of information that's being that we're bombarded with, you're not alone. I feel that way too. And what we're trying to do, both my colleagues at RAND as well as at NIMH, as well as kind of across entities, is weed through all that information. We've seen kind of an influx of information that hasn't been peer reviewed. So we're trying to do in real time quality control of that information to understand what really the burden is, where risk is highest for different outcomes, whether risk is higher, and really kind of try to intervene, and what are their best evidence-based approaches to intervene in certain places. So for example, we're looking at with my colleagues at NIMH, we're thinking about how can we work with people who have recently experienced a job loss to mitigate any kind of mental health consequences of job loss on their mental health. So those are the things that we're trying to do, is wade through all this information to find the really timely and relevant data, to advocate for more timely and relevant data, as well as to intervene and mitigate kind of any of the mental health consequences. So I think I'll stop there and we can kind of continue, because these, and I just end by saying these forecasts are predictions. They're, forecasting into the future. And the good thing about forecasts and predictions is that they're not truth. They're just kind of what we project. And it means that if we can forecast things based on data, then we could potentially intervene and disrupt that forecast. And that's what that's what I'm motivated to do. That's what I want to do. And I think that that's what we should be doing as a community, especially looking at our veterans. So I'll end there.
Okay, no, thanks, Rajeev. And I'm already interested in learning more about what you guys are doing in terms of what some of those mitigation strategies may look like for job loss. And also hearing more about the report that you were involved in with Bob Woodruff Foundation. Now let's go over to Rosie Torres, the Executive Director for Burn Pits 360. Rosie, I'll turn it over to you.
Hey, Sam. First of all, sorry and my deepest apologies for the mishap here with our webcam. Yeah, just thank you for the opportunity. Thank you for having us. A little bit of background here on me is, again, I'm the co-founder and executive director of Burn Pits 360. I worked for the Department of Veteran Affairs for 23 years. And again, after my husband returned from deployment, began facing respiratory issues and was then diagnosed with the disease. And really after meeting an online community of families, survivors, veterans, active service members, reservists, all with that same common denominator of really just trying to figure out how to access this, and improve the system of delay and deny they were facing. And so, we created Burn Pits 360. And so our goal really is to connect those individuals affected by exposure through our advocacy efforts, through outreach, education, research. And as a result of that, we developed our own independent registry, which really allows us to have access to that real-time data of what those systemic barriers are, what those needs are for these survivors, for these veterans affected. And so that is really how our approach to developing policy reform in the VA and DoD independent is through identifying those needs through our own independent registry. So, we're just honored to be part of this, and hoping we can, continue to form an alliance with the, everyday Americans, the community, nonprofits, and so forth.
No, thanks, Rosie. And like I've known Rosie since I joined Dixon Center, and she's just a dynamo when she comes out, and her passion for connecting veterans, not only advocating for them, but she takes a personal role in connecting veterans to treatment options who are dealing with the respiratory diseases and the cancers and other illnesses and conditions that have been associated with exposure to burn pits. So I'm looking forward to hearing more. And I think Rosie also, as we go on discussion, will also be able to talk about some legislative actions that are taking place right now that is going to be in support of our veterans and their families. So we'll get a chance to hear more about that. So I'll kick things off here, and I'm going to kick this back over to Amy and Cristy. I had the opportunity to listen to a presentation that Amy and Cristy did last month when they shared some of their observations and some of the things they've seen in treating veterans and their families in the last 6 months. So, and I'm not sure I can go with Amy or Cristy, but however you guys want to approach that. But I'd like if you could share with the audience more about what you've seen there in Eastern Seals, Greater Houston, in terms of the needs that veterans and family members, the needs that veterans and family members are presenting that, are kind of related to COVID-19, and some of the ways that you've been able to ensure that they have continued access to those services you provide.
Amy, want to go first?
Okay, so one of the very interesting things that I think happened, or maybe didn't happen, is that we didn't have a fall off in the number of clients that were coming to see us. It was completely, for us, it was a seamless transition from meeting with some folks in person, meeting with some folks sometimes over the phone or by video, to the complete remote work. Now, prior to the stay-at-home orders that happened, there were several veterans that would not meet at all over telephone, or they had some concerns about who might be watching or who might be listening in, some concerns about that. And what happened is that those things just completely melted away. They wanted to continue to keep talking. I had one of my veterans call me his COVID buddy, and he's like, "You can't get rid of me in the middle of this. We just are going to keep talking." And so some of our veterans are more comfortable with telephone service, and that's a really nice thing. Is that in the insurance world, it has to be face-to-face or it has to be video, but in our world, we get to provide the care that the client is wanting and needing. And if it's by telephone, okay, let's do it by telephone. Let's meet you where you're at. So I think there has been, in my caseload, a greater sense of urgency for a lot of things. At first, when the transition happened, there was a lot of disbelief, and then there was boredom, which is huge. And when people are bored, that's not good. They can get into trouble. And then then there was anxieties, sadness, loneliness, a lot of really big feelings and emotions over the time that we've been working with folks. People are resilient, and they're making big choices. I have a handful of clients that are making huge life changes, quitting jobs, moving locations, getting married in the middle of this, all to solve problems or to get in alignment with their values. Yeah, but a lot of loneliness as well. And I think that's a theme that we keep hearing about. If you can't go, like one of my clients lives in a senior center, or two of them actually, and one of the places where they got their social interaction was at the mailbox. They'd go down, they'd get their mail, they'd go and hang out where the coffee is, and now they're, like one of them said, it's a game of Frogger to get down and back to his apartment without interacting with anybody, because he knows that he's at risk for complications if he were to catch COVID. So there's a lot of stuff that we know that loneliness puts people at greater health risk. We absolutely know that. So that's kind of some of the things that I've noticed. I'm sure there's other comments, but maybe Cristy.
Yeah, so one of the things I really wanted to highlight is that it's not uncommon for veterans to have go bags, right? Or to have multiple go bags in multiple places. And one of the things that we found is that preparation really served many of the people that we see very well. So when the orders to stay home kind of came down, they were ready. And for some of them, it actually there was like a sense of peace for a little while, maybe 2 or 3 weeks. Like they knew what to do. It's as COVID and recommendations have shifted and it continued, the distress has increased. But I think this element of knowing what to do and being prepared. We have several people who are building gardens. They talked about agriculture earlier. And so they're trying to become as self-sufficient as possible, given this. So, and that keeps them focused on something other than what's happening. And so it reduces the distress. And we've seen that, like if people are consuming a lot of information about what is happening out there from a lot of different sources, because a lot of people want to be very educated, much like Rajeev said, there's a lot of information out there that can be very overwhelming, and we see the distress go way up. But if they're able to take that information and spend some of that time and do something with it, gardening, canning, prepping in other ways, home remodeling, then we see that this stress kind of stable, or at least plateau for a moment. So I think that's another really interesting thing that we see, and I'm sure we're not the only ones that see that. And so we really try to leverage all of those kind of natural, I shouldn't say natural, well-learned skills that veterans have so that they can ride through this as smooth as possible, because that's really important for us. It's, yes, we need to teach some skills sometimes, but it's often we need to start where people are good and feel solid. So that's a little bit about what we've seen.
Have you guys seen any challenges when it comes to, you know, just doing, I guess we've come to assume that they're simple things, just like the video conferencing, you know, among older veterans. And I'm speaking from someone that when this started, you know, when we really started getting heavy into things like Zoom and GoToWebinar and or whatever the video conference platform, I struggled with just working through just how to use it. Have you seen that among the veterans you're dealing with? Like, you know, especially older veterans, that they have trouble navigating, or it's just the video conferencing piece, or is that just a negative stereotype?
I'll go first if you don't mind, Amy, on this one. So I think we have two things that are for us an advantage. One is we were using telehealth for a year prior to COVID. So everybody had the option from the very beginning, you know, a year ago. So they knew that this was something. And, you know, people have life things that happen. So it wasn't uncommon for everybody that we see to do something like a telephone visit when they were running late, or have a call at lunch. So I think everybody had a little bit of exposure first before COVID hit. I think the other thing that we have that's very advantageous about us is that we have a program called Bridging Apps, and that was actually started by a veteran within our program, and one of the main trainers is also a veteran. And what they do is they basically provide all of this support to help people learn how to use their devices. They have a YouTube channel, they put things out all of the time. They provide one-on-one coaching. They were doing it in person and then transition. So we could have people call up, or we could have somebody from that team call a veteran and say, let me help you through it. So we've been really fortunate that to help people make that transition, or it seemed pretty seamless for us. But I don't know, Amy might have something else she wants to say.
Yeah, and I think the terminology of tech support sounds really like highfalutin, but our team can do the stuff that's just like, okay, let's help you like make your font bigger, or let's figure out how to turn the volume up. And they have the patience in our program, Bridging Apps, to slow down and speak at the level that the person's at in terms of where they're working with their technology. So, and then to take them just at their pace, just one step further, like how can, you know, what are your goals and what are you wanting to achieve with your technology? Let's see if we can't figure out how to leverage the technology that you've already got, or maybe try out something and then see from the library whether or not that would work for you. If it doesn't work for you, yeah, let's try something else. So yeah, and again, like I think I mentioned earlier that if the technology gets in the way, if the Wi-Fi signal is down in my house, then I can switch to a telephone call. And we make very meaningful conversations by telephone. It can work. The video conferencing offers us kind of a different experience to be closer into the world of the client. When they come into the office, they sit down and you can see how they sit, you can see what they're wearing. But when you're on the video conference and they're kind of going like this, you see their environment, you hear what's happening around them. If there's noises or interruptions, a couple of times I've had people who won't replace the battery in their fire alarm, and I can get on them about the safety of that. But it's because they're in their home and they're talking to me that I get some clues about the way that they're managing their life. Yeah, so there's some kind of growth edges for us as therapists to think about. Okay, you've complained 3 weeks about dishes. Could you do the dishes right now while we're talking? I don't mind. So where's your scrubber, and do you have your soap, and just really facilitating the movement towards what are you wanting to do? And we can still talk about stuff that's important while you're doing your dishes. It's okay. Let's do it. Let's get to it. Yeah, so there's some opportunities that you normally wouldn't have if you didn't have this technology in place.
No, that is a great observation, because I think a lot of us have automatically assumed that because of the pandemic that that there's going to be constraints to access to mental health. But it sounds like in many ways there's actually some opportunities there, maybe to better connect mental health services with veterans and their families.
I think there may be a little bit of hesitation to start when you can't meet in person, but that once you've started, it's easier to keep going.
Okay. And Rajeev, I wanted to bring you in on this. Like I said, as I mentioned, you've been involved in doing some significant work in terms of projecting what kind of some of the challenges, mental health challenges, and other challenges that veterans and families could be facing over the next months, or maybe even the next couple of years. So I want to give you a chance to kind of elaborate on that a little bit further.
Sure. I just want to start by saying, I just thought what Amy and Cristy said was so important. So first of all, I love this idea of teaching people how to, maximize their technology, because sometimes we have the solution, but it's not accessible to people for, technical literacy, if you can. And these little solutions, and I know, having worked, with my mother on her phone or other people, sometimes it's really frustrating. So having somebody who's there, who has the patience, just sounds so important. And I love when people we've always been asked, like, what can I do to help? It's like little things like that. Help, your elderly, like your grandparents or whatever, use their technology efficiently or come up with a creative solution. I love that idea. And I love that people are, that you guys have done that, and the opportunities. And from a telehealth perspective, I will say that, we've seen policy changes that have enabled this to happen. So we've seen there's currently policy challenges in licensure, interstate licensure. So somebody licensed in one state can't necessarily see someone licensed or it's a patient in another state. And we've seen policies that have kind of enabled that to occur in the wake of COVID, as well as we've seen reimbursement, like more parity reimbursement between telehealth services and in-person services. I think that we need to think about whether those should be long-standing or whether they should just be temporary. And I think that, forcing because as we've heard from Amy's example, the benefits that telehealth can provide in people completing their treatments and things like that are really important. So I think this is a moment to kind of to really capitalize on some of those policy issues. I would say, in terms of stepping back, as you said, Sam, we wrote this report I think we drafted it in February and it came out in April. So before the first ever, unemployment job report came out, we actually published the day before the full month's job report came out post-COVID. And what we did was really think about, was not just predict, and we didn't predict really, but we kind of estimated where we thought, based on the available industry, where we thought veterans were going to be hit hardest. So what we did, for example, was look at Moody Analytics produced the industries that they felt were going to be hit hardest by the pandemic, and we estimated how many veterans were employed in those industries. Then we looked at where are those industries concentrated, and how many veterans live in those like 15 cities that are primarily dependent on those industries, and then kind of said how many veterans are there to feel the second order effect, the third order effects. A lot of it had to do with popular tourism destinations, Las Vegas, Orlando. I don't remember all 15 cities, but those, in terms of populated cities, those kind of speak to me as the ones that were projected to be hardest hit, just because of their dependency on tourism, which was going to be constrained, and that affects everyone ultimately in those cities. So a lot of I'm trying to think of like what else to say. I think that one point that hasn't been touched on, so we know kind of the unemployment rates, we know that, job insecurity coupled with some other things, can lead to adverse health effects. And we can talk, later about how we might mitigate those. And I think telehealth is a clear example. One of the things that we really thought about was financial security among our veterans, as well as our general population. To be honest, I think that COVID has really put out that, veterans are people too. So what we see veterans experiencing in the wake of COVID is not necessarily unique to veterans at all times. I'm sure, when we hear about the burn pit exposures, there may be some unique circumstances, but these are things that all Americans are going through. And financial security is one of them. So how much do people have in savings? What do they depend upon if they've lost their job, if their unemployment runs out or they're not eligible for unemployment? How long can they last based on the savings that they've had? And then if they don't have savings, what are their likely go-to solutions? And so thinking about payday loan, it's called, short-term loan, which come at really high cost, ultimately to individuals, as well as assuming credit card debt, and made us really think that how people are responding to the pandemic now is going to really predict, and how they prepared for it, unfortunately, is going to really predict, how long the pandemic stays with them. If they're assuming a lot of credit card debt, for example, that will prolong the duration of the pandemic. And maybe that's what they have to do. I'm not trying to make judgments, but I do think it's something that we have to be thinking about, is, the security, the financial security, and how we can intervene. And I've been talking to a lot of psychologists. I'd love to hear Amy and Cristy's discussions about how that financial insecurity plays into stress. And, I think it's and how they're really interesting techniques. Psychologists and social workers and counselors aren't credit counselors by any means, but they can use strategies in their toolbox to help their clients dealing with financial uncertainty and rising debt or rising loan, whatever it may be. And then I think we also have to think about when we start rehiring, when these industries start rehiring. And there is something that's really unique to veterans, which is, and we heard this already from Colonel Milne, which is the new veterans who are leaving the military are, if the past and the Great Recession is any indicator of what's to come, new veterans are going to have a harder time, just because for all the reasons that we've heard, that that translating, like, employers don't necessarily know what skills people are bringing in from the military, and if they don't have that track record of being in a civilian employment and they're leaving the military, they've already faced hurdles in getting employed. They may face additional hurdles as the job market has tightened, and the competition is greater, including from among civilians. We also should be really worried about, again, based on the past, about our older veterans who have lost jobs, who are trying to get employed, and just older Americans, people in, I would say their 50s, 55, who are looking to re-enter the workforce, but age discrimination does exist, and when you have a competitive labor market that's trying to apply for a limited number of jobs, who will get those jobs? Who will employers prefer? So I think we have to be thinking about those situations, again, when we think about the long-term effects of this pandemic, especially from an economic perspective.